Are you my next student? Okay. Let me just pull you up so I can sign you in. What's your last name? Okay, there we go. All right, so we have an hour together. Were there particular skills you wanted to work on? Yeah, absolutely. We can work on phlebotomy. Where are you at in your skills labs right now? Okay. No, absolutely. I totally support getting ahead of it. So let me just put this over here for a second. Okay. To start, we're going to get you set up with the proper equipment. You'll see I'm currently wearing this PPE gown, or we call it an OSHA gown sometimes. It is made of this sort of mesh fabric, and it looks like it's quite thin because it's sheer, but if you look closely, the mesh material is actually woven in such a way that it prevents any kind of spills from leaking through the fabric, which is great for protecting you and me, of course. So I'm gonna get an isolation gown, PPE gown, or OSHA gown, whatever you want to call it, on you as well, okay? Even if we only use the practice arm today, I still want you to wear a gown just to get used to the feel of it, okay? Okay, just slide your arm in. Good. Okay. And the other side. Good. And then let me just grab the ties. Let's get a little closer here. And there's also a waist tie, which I'll find for you. It can get lost sometimes. There we go. And I'll let you tie this around your waist. Okay. So, while you're in this program, anytime you're going to be handling any kind of fluids, bodily fluids, it's important that you put on one of these gowns, okay? Okay. We'll put on gloves in just a moment. So, okay. You haven't actually practiced any kind of venipuncture yet. You've only been reading through the module. Okay. Tell me a little bit about what you know. So your teacher is going to go over using a lure adapter and a straight needle with you. I think while I have you here in Skills Lab, we're going to work on something a little bit more specific. We're going to work on syringe draws, which are a little intimidating, and it does help to have some extra practice. People tend to feel a bit nervous with it because it is a little bit more of a delicate procedure, but it's also a skill that will transfer over to a lot of other skills that you'll need to know, such as placing a central line or a pick line, for example. Having that kind of control in your hands is really helpful. So, to start, I have my bin of supplies here. So, as you know, lure adapter, and I also have our standard nitrile tourniquets. I also have a couple other kinds though. So put that down for a moment. So this is one of the nitrile ones. We also have some others. So this one is not used very often, but it is kind of an interesting one. So this kind of works like a seatbelt, where you're going to pull out the desired length, alright? Clip it through, and then you can use this end to tighten to the point where you need it to go. These aren't very common because they are not disposable, and they're also a bit difficult to clean, so you won't see those very often outside of an educational setting, okay? But it is good to practice using them just in case you're ever in a situation where this is the option that you have. So that's this one. This is another one that isn't used very often because, again, this sort of material is very difficult to sanitize, and these are more expensive, so it's a bit wasteful to just throw them away, but it's Velcro, so I just go around the arm or wrist and fasten just like that. Really simple. But the version that we're going to use, which is most common, they're easy to clean, and they're also much more affordable to be disposable, and that is our nitrile tourniquet. There is a little bit of finesse in terms of tying this, which we will go over in a moment, okay? So, can you tell me why we would do a syringe draw? Yes. We do these in the case generally where people have smaller veins or more delicate veins or veins with a history of collapsing. This way we can have a little bit more control on our vacuum. I'm going to take out a syringe. Okay. Now, generally, you can do it with the attached needle. However, I find that you have less control in terms of keeping it gentler because, especially when I haven't used this needle before, see, it's quite difficult to pull that stopper. And if my needle was in somebody's vein while I was trying to yank it back, that could be kind of problematic and create a very strong vacuum very quickly, which might cause that vein to collapse. So first thing I like to do is just sort of warm up my stopper, because when I pull this back, trying to find a position here, I need to be able to do very slow, smooth movements. I don't want it getting stuck at any point, causing, like I said, sudden force. So that's why I always warm it up first. And I remove this. And trade it out. For a butterfly. That way I can have one hand holding these wings, keeping it steady, while the other hand is focused on slowly drawing back with control, making sure that we protect our patient's veins. Okay? How comfortable do you feel right now? That's absolutely okay. So we can absolutely use the practice arm to start, okay? And that way you can have some experience already having an idea of how to navigate where to go, including what it feels like to use a needle to puncture someone before going in with a real person. It's totally normal to feel nervous and to feel some adrenaline. I think everybody experiences that for quite a while, actually, until eventually you do start to adapt to the procedure and it becomes more just of like a day-to-day task instead of being something that's really anxiety inducing. But it's totally common. I went through it when I first started. I had the shakiest hands. I had to use a beta blocker to help and control my attention tremor, because the more attention that was directed towards my hands, the more they shook like a leaf. And now they shake, but that's because of an injury that I had a couple of years ago. But the reason I'm telling you this is so that way you know that if this is something that you experience, it's completely okay, completely normal, okay? And eventually you do grow out of it. We all do. Okay. So in just a moment, I'm going to move over our mayo stand here, so that way we have a working surface, okay? Real quick though, I have some gloves for you. These are nitrile, so if you have a latex allergy, this should not exacerbate that or cause any kind of reaction, okay? So pop these on. Okay. And I'm going to put some on myself. And then we'll get going here. If you're feeling nervous right now, that's okay. That's okay. Alright. I don't want you to feel embarrassed about that at all. We all have to begin sometimes. We don't walk into a new skill being an expert. So with a lot of nursing skills, often the introductory feeling can be some anxiety, and it's totally normal. There is no pressure here in my lab, okay? So if you're feeling nervous, it's totally okay, and I really appreciate you telling me. But don't worry. We're going to take the whole process nice and slow. I'm going to make sure that you feel comfortable with everything we're doing. And if at any point you have any questions, please don't hesitate to ask. Or if you feel uncomfortable with anything, if you want me to back up, go slower, anything, I want you to make sure to speak up and ask, or let me know what you need, okay? Okay. So I'm gonna move our stand over, okay? So we always get started using a paper drape just to protect our surface, okay? Sometimes you'll have a different kind of setup where you might have like kind of a little bench for someone's arm to rest, or you might be bedside and there might not be room for the drape, but when you're able to, it's always recommended, okay? So, going to bring our friend the arm here, okay? So, this arm is very vascular, and the veins are modeled in the same places as on a real person. So we have our median cubital here, which is usually the preferred route to take. Okay. We also have our cephalic vein on the outside. That runs on the side of the thumb. And our basilic vein, which runs on the side of the pinky. Okay. So to start, I'm just going to focus on this vein right here. And because of the way this arm is, I'm actually going to place it up just a bit. Let me just move the tubes. These tubes are here because they can be filled with liquid if we want to simulate an actual blood draw. We're not going to do that today. We don't want to add any extra pressure. So we're just going to look at this vein right here, okay? So, generally you want to use your index finger, and I'm just very lightly pressing and making sure that what I feel when I press lightly springs back, that there's a little bit of give that feels different from when I push here as to when I push here. And I'm looking for anything that might detour me, such as scar tissue, for example. And I'm also pressing to see if the vein rolls around underneath my fingertip. Okay. So this is that nitrile tourniquet. So what I like to do bring it underneath the arm. Okay. I'm going to anchor this end. I'm going to take, actually let's even this out a bit, this side. And I'm going to take this and just tuck. Okay. That way, it just very easily springs off. So, again, holding this end, pulling it so it's pretty tight, and just tucking it like so. Okay? However, in this case, we're not going to be doing a wrist draw, so I'm going to do this again. A bit higher up. Oh, nope, that didn't want to stay. Come on. There we go. Since this isn't actually skin, it's a little bit persnickety. So, I'm going to use this vein right here, okay? just fell. Oh. Okay. Different syringe. Okay. So I have some tubes here. I have a lavender, a blue, and a red. Can you tell me which order I would draw these tubes? You're right. Blue, red, and then lavender. And how come? Yep. You don't want any of the EDTA to get into this tube or this one, because this one keeps the blood from clotting. And this one helps us know how quickly the blood clots. Get our cotton. And I always like to have my tape on hand. Just put that in there. Okay. So the first thing we need to do is clean, okay? So a lot of people think, oh, just back and forth, back and forth, back and forth. But all that's doing is moving the bacteria back and forth, back and forth, back and forth. So what I'm going to do is start in the center, using a circular motion to move any bacteria away from the portion of the skin that we're going to be puncturing. Okay. So now, this tube coming from the butterfly does have a slight vacuum effect to it, so that if this syringe becomes full, you are able to disconnect the two. And then in that case, it is handy, and let me grab it. To pop this back on so that you can inject the blood into the tube. Now, we never recap needles, but in this particular instance, we're gonna let that slide. All right. Put this back. So then one more thing before we go, you'll see that there is a hole and that the tip kind of is diagonally slanted. We want that hole with that slant facing up. Okay? So there are a few ways to do this. A lot of phlebotomists, a lot of nurses have their way and think that their way is the way, but a lot of ways are correct. It's just what is comfortable for you. Some people like to pull the vein up. I personally like to pull the vein down. Sometimes people will, if it's a very rolly vein, use two and kind of go in at sort of a swooping angle. It's up to you. So generally, in this particular case, I'm using my thumb, or maybe I'll use my index finger, okay, and I'm anchoring that vein so that way I'm pulling it down. It's not going to move on me, and boop, in we go. Now, if this was a real arm, there would be a flash of blood right here to indicate whether or not I was actually successfully in the vein. Okay, but as this is not a real arm, there is no flash. So now, sometimes if necessary, you can pull out a little bit if you went too far, but always keep an eye on this vein, particularly if it's delicate, just to make sure that you can still see it. It's not disappearing or showing a sign of collapsing. And then you slowly pull back the stopper. Okay. So, how about you go ahead and give it a try? Okay. So, pull this out, and I'm going to undo the tourniquet, and that way I'm able to supervise you, okay? Okay, good. So you're going to start, yep, taking this tourniquet and, got stuck there. Yep, around, just like so. Good. Alright. So now what you're gonna do next? Oh, yeah, of course. Sorry, let me. Get that for you. Good. Yep. Start in the middle. Move outward. Good. Okay. You're doing great. Go nice and slow, okay? It's totally okay to be nervous. You're doing great. Good. Okay. Okay. Now make sure that you're comfortable. You've got a good angle. You feel comfortable with that? Yep, go ahead. Good, okay. So now you're gonna very slowly draw back the syringe. Yeah, you would take the tourniquet off now. We can take that out of here. Okay. Very nice. Okay, now before you pull the needle out, make sure that the amount of tension. Yep, good. You don't want to have any kind of pulling or vacuum in motion while you pull the needle out, or else it's going to be messy. Okay, so then you would take your cotton and you can have your patient hold it if they're able to while you dispose of the needle, okay? Always want to make sure you get rid of that needle right away before even taping it. That way you don't risk anyone getting an accidental needle stick. And then, provided I can find the end of the tape, so I always like to anchor this by putting the tape on one side and then folding the skin as I tape it on the other side, and that actually puts pressure on the bandage. Little trick that helps. So how did that feel for you? Totally understandable. Like I said, it's gonna take some practice. And get this out of here real quick. Put that over here. Yeah, I put these boxes under the table so that way it stays even, because nail stands tend to kind of slope just a little bit. So, alright. I'm going to pull you up again here. So, did you have anything else you wanted to work on in here with me? Okay, because I don't have anyone after you, so if you wanted to take some more time, you're totally welcome to. No? Okay, that's fine too. So, just a moment. I will write it. Notes here, just because this way we keep all of our students' information, even with their skills labs and their files. So is being a little bit stubborn about going back in the sheet protector. Okay. Well, you are welcome to use this time to spend studying or researching or practicing with any of the equipment in here if you'd like. Yeah, feel free. I'm just going to be doing some work of my own in here for a little bit. Oh yeah, that's totally fine. You can feel free to go whenever you're ready. You just want to doff your gown and your gloves. You can just put them in that bin right over there on your way out. Okay. Well, I'll see you soon. Feel free to come back and schedule with me anytime, okay? You did really well today. I'm really proud of you. Oh, for real, you did. It was really good for your first time. Even for somebody who's seasoned, you did really well. So,